Hi, my name is Anna Malie. I'm a mental health therapist and digital well-being advocate. Today, let's address the impact of social media on youth mental health. The constant connectivity and unrealistic standards can lead to anxiety, depression, and isolation. We need open dialogues, education on healthy online habits, and advocacy for platform changes. Let's empower our youth to navigate the digital world with resilience.
Hi everyone, my name is Himajin Nagarati and I served as the 11th Youth Observer to the UN. Mental health is such an important topic to discuss, and if there's any words of advice, wisdom that I would give to my fellow changemakers and also hold myself accountable to is that we need to continue pushing for more mental health recognition in spaces outside of traditional advocacy. We need to continue pushing for it in academia, in the workplace, all around, to making sure that everyone feels like the spaces that they're in are protecting their health and well-being and the health and well-being of their loved ones.
My name is Sheldon Thomas. I'm 17 years old and I live in Michigan and I'm a senior in high school. So I'm a mental health advocate, and one of the reasons why I started is I've struggled with mental health my own. And also on top of that, one of my best friends committed suicide. And one of the biggest pieces of advice I have for change makers is to just be real. I think one of the biggest ways adults specifically can support youth mental health is by listening, not necessarily thinking that what kids are going through isn't important or minimizing or trying to mitigate like our feelings or emotions. Thank you, and I hope you guys enjoyed.
As a youth advocate, I've only continued to see how underrepresented youth of color are in the psychology field. Looking at the demographic of psychologists, you don't find many people of color who are therapists and clinical psychologists. And as a person of color myself, growing up in a Hispanic household, I've always felt the stigma of mental health care, pretty much based on how there is a lack of representation. So I think that if culturally informed practices are implemented into these spaces, then youth of color will feel more comfortable in seeking therapy and considering mental health as an important part of their health.
T Speaks NYC here, adolescent therapist based in New York. So one of my favorite mental health tips for young people is to practice coping skills and self-care as part of your daily routine. If you're only using coping skills during those times when you're overwhelmed, frustrated, and stressed out, it can be really difficult to know what to do during those times. But if you're incorporating coping skills and self-care as part of your daily routines, during the times you need it the most, it won't be as difficult to know what to do to help yourself feel better.
Hello, my name is Marcus Alston. I'm the founder and executive director of Alston for Athletes. One issue that I've seen in my work is that coaches go through no formal mental health training. They're considered a first responder for a student athlete. They go through CPR training, heat illness training, anti-bullying training, but they go through no formal mental health education to help athletes out who are in crisis.
The reason why I got involved in mental health advocacy was because I knew that youth were not being adequately and appropriately incorporated into making mental health systems work for people of our age. What it comes down to is ensuring that all of us, regardless of our age, background, or identity, are able to gain access to the best care available for mental health challenges when we need it most and in prevention of it. There will always be a space for youth to become and remain involved in this endeavor, and we need as many people as possible to remain engaged and forthcoming in their experiences and the experience of those they love to ensure that this system and this discipline move forward as best as possible.
Hi everyone, my name is Latifat Odunuga. As someone with over 10 years experience in mental health, I have witnessed the struggles that individuals living with mental illness face, particularly in my hometown, Lagos, Nigeria. At the time, we had less than 200 psychiatrists in the entire of Nigeria, and we also had very limited number of professionals that were like really focusing on mental health and mental illnesses. It is very heartbreaking to witness people on the street walking, looking disheveled, with no support system. Thankfully, the landscape of the mental health revolution has changed, with more resources available now online to help those struggling with mental illness. One of the few centers dedicated to the treatment of mental illness is the Federal Neuropsychiatric Hospital, Yaba, in Lagos, mostly known as Yaba Left. This hospital has a kind of like negative perception that comes with it because people are always very scared of going to seek mental health treatment. Please, it is important for you to know that seeking help for mental health is a brave and necessary step towards healing. We have to all come together so that we can break the stigma surrounding mental illnesses, so that we can help those people that are in need and need our support.
Hi, my name is Ilana Drake, and I'm a UNA USA Global Goals Ambassador for SDG 10, Reduced Inequalities. I'm speaking about Mental Health Day and how I actually got started in writing about it and speaking about it. I was able to write about mental health for a piece in Wire Media on college students and their mental health after thinking about my own college campus and how we don't really speak about mental health as often as we probably should. After COVID, I noticed how a lot of education was very disrupted, and I started to think about how this really impacted people's moods as well as mental health diagnoses. So in my piece, I was able to think about stress levels as well as anxiety and sort of what contributes to that, as well as what resources there are to actually help college students. And I continue this work through looking at high schools across the United States, as well as thinking about education more generally, as well as shaping education in the future.
Hi, my name is Lauren McNair, spokesperson for YHelp. I'm a biology major and chemistry minor at Howard University, and balancing school and study can be really hard for young adults. What led me to this work is the fact that mental health is not prioritized in the STEM fields enough, with some reports saying about 40% of biological and physical science majors have moderate to high levels of depression and anxiety. This statistic needs to be changed, and that's why I decided to advocate for mental health for all students. To learn more about mental health, follow at YHelp Now for mental health resources and how YHelp supports teens with mental health.